canal of a lower molar, we'll be focusing on the mesiolingual canal. All of the other canals are prepared in the same manner. Once a straight line access has been established, thoroughly irrigate and lubricate the space. This is recommended after every rotary file. Begin with the number 10 hand file. It doesn't take long to scout the canal space. This is worked to about 2/3 of the estimated depth of the canal. Based on the anatomy, the next hand file is pre-curved. The number 15 file is worked gently to create a glide path for the rotary instruments. It goes to about the same depth. Coronal shaping begins with the S1. This is used at 300 RPM and can be worked in a brushing manner to move the axis away from the furcation. The S1 is taken no further than the depth of the 10 and 15 hand files we worked with earlier. It may take more than one pass to get to that depth. Shaping file 2 is next. It goes to the same depth as the S1. While it may not always be necessary, the S2 can also be used in a brushing fashion. Here, it goes easily to the predetermined limit. Throughout the procedure, use of sodium hypochlorite and a lubricant such as Prolube is strongly suggested. These help by digesting tissue and clear the way for files as they work their way down the canal space. After the initial coronal shaping, the number 10 hand file is reintroduced. The 10 is negotiated to the estimated working length and gets to length quite easily here. Because of the coronal shaping done with the earlier instruments, this hand file will normally engage in only the last few millimeters of the space. The number 15 hand file is then allowed to follow. These instruments create enough of a glide path to allow the ProTaper universal instruments to comfortably shape the apical portion of the canal. S1 is reintroduced and is easily taken to length. Once it reaches working length, remove it. The S2 easily follows to length, and the canal has a nice tapered shape throughout. Always remove, clean, and inspect every rotary instrument frequently throughout the procedure. Only the final apical size is still to be determined. It is often appropriate to reconfirm length determinations after principal shaping is complete. This is important because removal of obstructions in the canal will actually shorten the distance between the coronal orifice and the apex. Finishing file number 1 is taken to length. This instrument has a 20 tip and decreasing tapers. It will provide deep shape, but do almost no work in the coronal portion of the tooth. Apical gauging with hand files is suggested to determine a final apical shape. In this canal, the 20 hand file fits appropriately. Although we're happy with the fit of the 20, for this example we tried the 25 hand file. It is also gently worked into the canal space. In this specific canal, it is too large and does not quite reach length. We also tried the 30 hand file. It is also placed in the canal, and as expected based on the previous hand files, it takes more effort to get close to the working length. Therefore, the clinical decision for this particular canal is to leave the preparation at a 20. To show canal variations, let's take a look at the gauging procedure of the distal canal of this same tooth. This canal followed the same instrumentation procedure as the others. The 20 is loose. The 25 is also loose at length. The 30 hand file will make it, but it is tight. The clinical decision is to use finishing file number 3 for apical shape here. The F3 is taken to length and removed, and the canal shaping is complete. ProTaper universal obturation begins with a completely clean, shaped, and dried canal space. We'll look at the same molder case from the clinical instrumentation segment of this disc. The choice of the appropriate size of obturator is predicted on the ProTaper Universal Size Verifier. In this clinical example, the yellow-handled F1 size verifier is placed in the canal. This verifier exhibits a passive fit at length in this canal. Because the ProTaper Universal Size Verifiers are nickel titanium hand files, some fine-tuning of the apical prep can be accomplished with these. It is important to remember, however, if any cutting is performed, the canal should be re-irrigated and re-dried. Additionally, if BioPure MTAD is to be used in the canal space, it must be the last liquid irrigant in the canal space. So it should be incorporated after you are sure of the fit of your size verifiers. With the size confirmed, the matching obturator is placed in the ProTaper Universal Oven. Proper placement in the oven is when the handle rests in the arm and the stopper is below the arm. The oven arm is then gently lowered and will lock into place with the obturator in the heating well. The appropriate size button is pushed, as well as the start button for the left or right side to begin the heating. A beep will indicate that the obturator is at the proper temperature for placement. During the heating process, sealer should be placed in the canal space. A non-eugenol sealer such as Thermoseal Plus is recommended for use with the obturators. A thin coat of sealer is placed using a paper point. A clean paper point is then inserted into the canal space to blot out excess sealer. When the oven has beeped, the oven's arm release is pushed and the obturator is lifted out of the well. It is removed by the handle and is ready for immediate placement. In this example, we filled the mesial buccal canal first to show that there is often enough space to allow obturators to be inserted one right after the other without the handles being removed until all the obturators are in place. The obturator is gently pushed into the canal space until the stopper reaches its resting place. With the obturators in place, a high-speed burr is used to sever the handle at the canal orifice. ProTaper Universal instruments were designed specifically to answer some of the problems associated with difficult cases. They can be utilized in a variety of situations. The sequence for most canal preparations is as follows. Explore the canal with small hand files to 2/3 of the depth of the canal. Use shaping file 1 to resistance in a brushing motion for coronal shape. Recapitulate with the S1 as needed to reach the depth of previous hand files. Use shaping file 2 to reach the same depth as the S1 and the previous hand files. Recapitulate if necessary. Use the number 10 and number 15 hand files to explore the remainder of the canal. Use the S1 to working length, recapitulating as necessary. Use the S2 again, recapitulating as needed to reach working length. Reconfirm working length. Use finishing file 1 to working length. Use hand files to gauge the apical foramen. Use finishing file number 2, 3, 4, or 5 as necessary. ProTaper Universal obturators are designed to quickly and completely fill space instrumented with a ProTaper instruments. The sequence for most canal preparations is as follows. Irrigate the canal space to remove any remaining debris left after instrumentation. Thoroughly dry the space with paper points. Using the last ProTaper